All right, welcome everyone to the 2024 IMPaCT Summit. It really is great to see everyone in 3D. We spend so much time behind our computers that it's really great to spend some time in person. So as we come together today, I just want to be mindful of the deep history and culture that are intrinsic to this land, where we're going to spend some time in 3D together. So I'd like to start by sharing our land acknowledgement that was delivered by Dr. Malcolm King. On a national level, we encourage all Canadians and visitors to Canada to learn about the Indigenous peoples on the lands in which they live, work, and visit, and become engaged allies together. We as Canadians, in the spirit of truth and reconciliation, respect the self-determination of the First Nation, Métis, and Inuit, and their rights and responsibilities in culture, language, and the pursuit of wellness. And today, while we are coming kind of from all over Canada, I want to acknowledge that we are here today and honor those who have and continue to steward this land here. So today we are gathered on the traditional, ancestral, and unceded territories of the Coast Salish people, including the Musqueam, the Squamish, and the Tsleil-Waututh Nation. And here at IMPaCT, we're really committed to taking actionable steps to ensure that the next generation of perinatal and child health researchers are educated and informed about some of the harms of the past and how these continue to affect the inequities we see in our healthcare system and in health outcomes. And so by acknowledging the land, I hope to not only remind myself, but also everyone in this room of what you can do in your day-to-day practice as a researcher, as a clinician, as a patient partner to make your practices more inclusive, and think about whose data is not informing the care that they receive, and how making trials more accessible can actually be a meaningful step towards generating better health outcomes. And so I really wanted to take this opportunity. We're going to have some cultural teaching tomorrow morning, but this morning I just wanted to reflect a little bit and acknowledge some of the folks who have been, supporting me along kind of my journey in this space, including both Drs. Malcolm and Alexandra King, who I don't see in the room today, but I hope are arriving, and they sit on our IMPaCT steering committee. Ashley Hayward, who was unfortunately unable to make it today and has always been just a text message away when I have some questions about how we can build impact in a good way. Dr. Elder Roberta Price, who actually opened for ITSE yesterday and sits on our steering committee for some of our perinatal opioid work. And if you've ever met, I don't think I've ever met a more honorable and inspiring and generous leader in this space. And Dr. Wanda Phillips-Beck and Taylor Morriso and her team that are leading some groundbreaking work in Indigenous data sovereignty and biosampling. And all of this is going to be relevant for our trials. So I really look forward to using IMPaCT as a way to uplift some of the work that's going on in this space. And so in IMPaCT, I think, I delivered a lot of land acknowledgements before I really understood what they were about. And so when I took some cultural safety training when I moved to Manitoba, I really started to understand about some of the systems that we work within and how they continue to oppress people. And so I think in IMPaCT, one of the things that we've done is make it mandatory. So all of our fellows have at least 3 hours of training that Malcolm King delivers, and provide opportunities for further education. So we also offer a 10-week program in Indigenous cultural safety training that we will cover for any of our mentors also. So if you are a mentor in this room and you want more training in this space, find Chelsea and she will get you connected. And so just know many of the folks in this room, but for those of you who haven't met me before, so my name's Lauren. I'm an associate professor in pharmacology at the University of Manitoba. I'm English and French Canadian, and I was born and raised outside Toronto, and I moved to Winnipeg in 2017. So these remind you to have the dreaded past experiences as an ICU parent, but I've also been a participant in clinical trials. So I'm a sponsor PI. I run 3 of my own trials, but my son was a participant. This is his first and last study visit with the best research nurse in the world. And so we were participants in the Moderna vaccine trial. And it's really quite humbling to look at all of the faces in this room today and somehow think why I'm the one up here, but I can't start without thanking all of the amazing people who make this meeting happen and keep IMPaCT running. And so that includes our co-director, Nancy, who is right here, and Chelsea and Zena and Linda. And I'm sure you've all interacted with these amazing humans over the past couple of days, and really we wouldn't be here without them. And thank you to our first cohort of trainees who are very patient with us as we get our content rolled out. I promise that it is coming. We just got some audio scripts this morning, so really, it is really coming, I promise. And I mean, I think I made a joke, my imposter syndrome is really at an all-time high because Peter Gill is going to be observing my steering committees for my trial. So Peter, wherever you are, just keep your expectations low. But for the rest of the room, I think we should all be really excited and have high expectations for everything that we can achieve in the next couple of days. So today, I'm just going to provide a really quick update on what we've been doing, what our mission is, introduce the fellows very briefly, and then I'm going to turn it over to the rest of our speakers for the morning. So IMPaCT is a clinical trial training platform aimed to increase clinical trial capacity in perinatal and child health in Canada. And to do this, what we want is to create a common space for training and mentorship in clinical trials that will harness the existing strengths of many of the research groups in this room with sustainable and accessible infrastructure. And so IMPaCT is going to do three things. We are creating open and accessible online learning. This will be open to everyone outside of IMPaCT as well. There's no cost to access these 5 courses, which I'll share about in a moment. We offer immersive learning and one-year fellowships. So you'll meet all our fellows tomorrow, but we will have a new competition launching for next year as well. And our cross-sectoral summit. So this is where we all are today as an opportunity for professional development, expanding networks, and building on some new methods. So last year at our first IMPaCT Summit, we asked all of you what you wanted IMPaCT to do. What did you want IMPaCT to be for you? And about 46 of you filled out a survey, and I put it in ChatGPT, and I said, what are the shared goals of people with these responses? And honestly, it was really good. They did. So our goals are really to be innovative. We want to create an innovative mentorship program that includes patient partners as mentors, and that really is multidisciplinary. We want to foster mentorship and education. We want people to know where they can come if they have questions about trials or they want more training in different areas. To increase safety and trust, we have to acknowledge that the general public doesn't really trust clinical trials. That word is scary and associated with a lot of negative experiences. And so we need to acknowledge that, and we need to do things that will build trust with the public. And being collaborative and inclusive. So I think in all that we do, not only, but we really do believe that including patient partners from the beginning is going to make all of our trials better, more meaningful, and more likely to actually improve outcomes at the end of the day. So when I say IMPaCT as a community, I mean, we have more than 90 mentors. So thank all of you who have volunteered to get involved and to help mentor the next generation. We have 14 amazing parent and youth engagement experts that mentor all of our fellows, and Nancy and I on how to do this. We have 18 fellows that started in the program this year, and 6 enrichment group leaders, and those are the folks who come to us from the Enrich group. And we have more than 30 partner organizations. And so thank you to all of our partner organizations. This really, I think everyone's energy has been really inspiring to me and really validating that this was something that was really needed, was a communal space. I think someone said to me, no one wants to do the training, Lauren, you can do it for everyone. And that's great. We want IMPaCT to really be a trial support for training for all of these groups. So our team, so Nancy and I steer the ship with the support of a fantastic team. So Maureen Smith, who's one of our patient mentors who stepped up to really help us with leadership in the patient and family engagement space. Chelsea, I feel like if anyone deserves a standing ovation, it's really you, because you are the muscle that keeps us all in line. You built the ship. Linda, who I'm sure is running around trying to manage a million things, but many of you in this room know Linda, and she serves as our platform manager. Zena, who does all of our communications, and then Martin and Vivian, who stepped up to mentor our enrichment group. And so really, you know, many of you have traveled far to be in the room with us today. So thank you so much to our youth and parent engagement specialists. I'm going to talk a little bit about sort of an exciting initiative that we're launching with this group, but it really is novel to have these patient mentors and actually have our fellows get experience in engaging patients during their training. And so we asked our patient and family partners to work with us on some guiding principles that we started with the patient and family partners and fed back to the scientists about how are we going to work together in this space. And so we came up with 5 guiding principles, which are mutual respect, respecting different kinds of knowledge, seeking balanced powers, and really recognizing the importance of lived experience. Supporting ongoing learning. We have to acknowledge that no one is going to know everything at all times. And so we really want to encourage professional development in our mentors, in our trainees, but also in our parent and youth specialists. So if they want to become more involved in research, how can we support them with continuous learning? All questions are good questions. That goes for today as well. So if anyone has questions, please don't hesitate to grab a mic. And how we balance powers and respect people's time, not asking people for things that we're not actually going to action, and really committing to being efficient in how we engage. Transparent collaboration, this just, is about communicating clearly, setting expectations up front. How often are we going to meet? What are you going to do? What am I going to do? When are we going to touch base again? Oops, going backwards now. Trust and authenticity. So I think showing up as yourself, acknowledging, the things you know, the things you don't, and building these relationships with an open mind. Oops. And then finally, inclusiveness. So really making an effort to value different kinds of knowledge and different voices, different perspectives, passions, and preferences or perspectives. And so with that, I'm going to very quickly welcome our first cohort of fellows. That is because you are going to all hear from them and they will introduce themselves and their trial ideas tomorrow. So we do also have two fellows who deferred to start with us next year. So Danielle Baribo in Toronto and Taylor Morrisseau from Manitoba. And so today you're kind of like not going to do that much work, but tomorrow you're going to be doing some small group discussions and also some evaluations of the elevator pitches. So you will get to hear all of the trainees introduce themselves and their project ideas tomorrow. So I'm going to go very quickly through this. We have 5 wonderful doctoral students. And so where you see other institutions, these are partnered fellows. So some of our fellows are parts of partnership agreements with CanArt, with Where Kids Can, with One Child, Every Child. We have 4 postdoctoral fellows. So welcome to all of you. And we have 9 early career researchers that joined us in our cohort this year. We also have 6 enrichment group leads. So these are the folks who do the enrich curriculum. So the difference between this group and our fellows is that they're not working on a specific trial idea. So they are getting trial methods mentorship in general from Martin and Vivian, and they complete the enrich curriculum, not the IMPaCT curriculum. So that's the difference there. A special welcome. I think there's a tie for who traveled the furthest. So we have 2 people joining us from the University of Global Health Equity in Rwanda, and we're thrilled that we're going to have hopefully 3 fellows who are going to be headed there in the fall. And so a really extra special thanks to Jennifer Clayton and Chelsea, who have planned a second week. So they're staying for 2 weeks, and next week they're doing some on-site learning at BC Children's. So a huge thank you to the team at Women's and BC Children's for putting all of these events together. There is a scanny code thing on there if you want to attend the Lunch and Learn. So BC Children's is hosting a lessons learned from their clinical trials. There is a virtual option. So if you are physically in Vancouver, you can go in person. There will be lunch. Or if you want to be in your pajamas or live somewhere else, you can join virtually. So please register for that session. And they're going to be doing a bunch of other things. So thank you for all of you who have helped make this really good partnership. We also have some folks joining us from some of our other partner organizations. So we have some folks from CanArt and Pitch and CanStat. So welcome to all of you. I'm going to give a quick update just on our curriculum, as we did add a core competency based on when we went through our education and really saw what we were delivering in all of our courses and all of the work that the fellows are going to be doing. And so we have 4 core competencies, engagement being the new one. 1, 3, and 4 haven't changed, but we wrote a 4th one on engagement, giving our trainees practical skills to facilitate involving parents, youth, and caregivers in the design and conduct and communication of clinical trials. So our IMPaCT fellows complete 5 courses. I'll show you those on the next slide. They attend our monthly webinars. They participate in discussions after the webinars close. They come to the summit. So welcome to the summit. And they participate in immersive learning. And I'll share a little bit about where our trainees are headed for their immersive learning journeys this year. They also develop a clinical trial protocol. So the IMPaCT deliverable for these fellows is a 10-page RCT protocol. So they leave with a grant at the end and sort of see their trial idea in the paper form. And so these are the 5 courses. We did, like I said, we got the audio scripts for course 1 this morning. So I promise you, I know it says June and it is June. So we know, we're getting it there, I promise. So we have 5 courses. The first one is an introduction to clinical trials, and a big shout out to N2. I saw Rebecca in the room somewhere for their assistance in getting us material for this first course. It has 3 modules. One is an introduction, one's on regulations and roles and trials, and one is on equity and safety considerations. Our second course was put together almost exclusively by the McMaster CanChild group and the FUR program. And this is an entire course about engaging patients and families in clinical trials. And thank you to all of you who have contributed videos and your stories to that course. It's really going to be very beautiful. So we're excited to have that course launched later in the summer. Our third course is a meaty one. They say 2 to 5 hours. That's probably the 5-hour one. And this is on design. So this goes over both traditional or conventional, I should say, trial design as well as adaptive trial design, and talks about different design features, trial operating characteristics, and how to make sure that you're asking the right question. The 4th course is on clinical trials operations. And this is really the nitty-gritty of the management, the day-to-day troubleshooting, being compliant, how to prepare for an audit, all that good fun stuff. And then the last one is on communication. So how do we communicate with the public about trials, not only sharing our trial results back to participants, but how do we let people know what clinical trials are and where to find them and why they should be a part of them? So all of our courses will be on RISE, which is the Raising Interdisciplinary Science Excellence. I think I'm looking at, yes, okay. And so it's myrise.lms or my.riselms.ca. This is the platform that's used by, I want to say, about 10 other health research training platforms. So you can create an account on there and you can access a whole bunch of training, not just in trials, but in other places too. So I really suggest that if you haven't made an account yet, check out what's on there. But this is what the IMPaCT learning pathway looks like. So you can see they do their TCPS core training. They do their 3 hours of Indigenous research ethics, and they do the Porch modules as an introduction to engagement. So part of our curriculum is immersive learning, and this is where our fellows are going this year. So we have 13 fellows that will be joining the CanStat annual meeting for some more training in biostatistics, and we think this is going to be a great opportunity for statisticians and non-statisticians to meet each other and recognize the value that each of you bring to the team. Fellows that will be doing the Families Engagement and Research course, so that's a practical course run through the CanChild group, and 6 that will be doing the SANYAS anti-racism and Indigenous cultural safety training. That's the 10-week program I mentioned earlier. We have 4 trainees that are doing some knowledge translation training, and then 3 that are going to be going to UGHE for global health and trials, immersive learning, and 3 that will be going to Sick Kids for the Child Health Policy Accelerator with Dr. Moore Hepburn, who I think I saw somewhere, but if you want to give a wave, go for it in the corner back there. And then we have also, so again, Peter is going to join my steering committee. Good luck to you, Peter. And we have a fellow who's going to be joining the PCON and looking at clinical trial execution. We have one fellow who's going to go to Germany for the Society for Reproductive and Infant Psychology meeting, one who's going to come to Winnipeg for the International Meeting on Indigenous Child Health, and one who's going to take a Bayesian Adaptive Trials course out of Hopkins. So these were broad experiences, and they were able to also suggest their own experiences that they felt would complement kind of where they are and where they want to go. So our webinars have been really well attended. So thank you all who have been sharing these webinars. So we had one on the basics of youth and parent and caregiver engagement. And we had one that Beth Potter and Pranish did on clinical trials and rare diseases and the role of patient registries. And so we had 83 people for the first webinar and 128 for the second webinar, which is fantastic. We have some great speakers. Dr. Tamara Lewis is going to give the next one on racial and ethnic diversity in pediatric trials, current barriers, and a path towards inclusive trial design and conduct. So these webinars are open to anyone. So you just need to register. You can share the link with whoever you like. And so please do share them within your network, and you can find them on our website on the events tab. So I'm just going to talk quickly, and then I'm going to turn it over to Alicia for our first talk for today. So first up, we're going to hear from Health Canada. We're going to get an update on the Pediatric Drug Action Plan. Then we'll take a couple of questions, and then we're going to start our first session. So our first session is on designing for dyads. And so this is really a session around designing clinical trials that reflect the needs of both pregnant people and the babies and their children. And then we're going to have a series of short talks. So these are kind of more rapid fire talks, and then we'll have a panel discussion. So there might be time for one question in between speakers, depending on how they stick to their time. And I will be up here. So if you see me get up, it is your time to be done. But we have a panel. So we have a 45-minute panel. If you have questions, there's notepads on the paper. Please jot down some notes, because we'll have 45 minutes to have questions with the whole panel up here. And so Fabiana, thank you for agreeing. I lost where everyone is sitting, but wherever Fabiana is, thank you for agreeing to moderate that panel. So we'll call you back when that's time. Feel free to drop in. Tomorrow, so we are back in the same room tomorrow, and tomorrow we have 3 sessions. So we have our session on patient and youth engagement in trials, and this is going to be a really excellent session, and I hope and then we're going to do some small group work around, where are we actually going with some of these challenges that they bring up, and how can we make our trials better. We're going to have our elevator pitches. So that's where each trainee is going to get 3 minutes to tell you about themselves and what they're up to and what they're doing and why their idea is important and why they're passionate about doing this research. And the enrichment group, for those of you who are here, will go to the Junior Ballroom D, which is also on the 3rd floor. Everyone else will just be in here. We're going to start. We have a very busy day both days, so we will start it right again at 9 a.m. sharp. But there is an opening ceremony tomorrow at 7, and then breakfast from 8 to 9. And then we have in the afternoon, we have our session on building teams and designing trials that respond to diverse populations. So we'll have a talk from Alison Orth and Minaza Jamil on addressing newcomer needs in clinical trials and some of the barriers for those who are newcomers to Canada. And then we're going to have a panel with some different trialists and learn about what they do, or different trial team members, I should say, and learn a little bit more about what a knowledge broker does, what a monitor does, what does a statistician do, and what a trial manager and a knowledge broker, trial manager, statistician, and monitor. So if you have any questions about what those roles are like or what they do or how to find one, save them for tomorrow. And then tomorrow there's a poster session. So I know lots of folks might have posters to present for some of the other research groups. We don't have an IMPaCT specific poster session. So this is the main poster session and it is in the North Tower upstairs, Pavilion Ballroom. Upstairs. Okay. And then there's a keynote dinner. So Bernard is giving the keynote dinner tomorrow. So I'm sure it will be excellent and trial relevant. And so there will be a dinner from 6 to 9 that has a keynote. So I thought just for my last couple of minutes, I'd talk about what we're doing this year, like what's coming next for us. So yes, the courses will launch. We're going to review the RISE registration process because some of the questions in there don't necessarily reflect sort of what we would like to see in the registration process. But again, it's a collaborative. So we work with quite a few other training platforms on that. Our sustainability plan. So we spent all day yesterday talking sustainability with ITSE. So thank you for the inspiration, but we need to do some hard thinking about how are we going to test. I'm looking at Samir because I know you're also having these discussions for CanStat. And so, what is a program size that we could reasonably maintain. And so we'll have some discussions with our oversight committee and then we'll share that back to everyone at our mentor meeting in the fall. So our evaluation plan, so Maureen has really inspired us to lead a formal evaluation of engaging our patient mentors in a training platform. And so that's a really innovative component. And I think will hopefully help inform how we do it better, but also inform and encourage other training platforms to involve patient and family mentors. And Leslie Pritchard, who I think is also here, we're going to work with the other health research training platforms on how do we evaluate training overall? Like what is a training platform? What is a good training platform? What should we be measuring? And so we're partnering with Enrich and some of the other health research training platforms for that evaluation. For any of we are looking for like 3 to 5 mentors to be involved with the patient engagement evaluation, and the usual honorarium applies for the parent and youth mentors. And there will be a publication for any of the academic folks who are inspired and want to sort of build some literature in the space around parent and partner mentorship in training programs. So all of our applications, and so our selection committee process prioritizes trials that are responding to needs of underrepresented groups. That will continue for the fall competition. We will continue to allocate at least 2 training awards for Black and Indigenous applicants. And this year we're going to have some priority areas. So this aligns with some of our partners. That means we can train more people. So these partners pay half of the salary awards, and that means we can offer more awards. So we'll have some in Women's and Girls Health, partnered with GROW, and Neurodevelopment, partnered with CanArt, in Rare Disease, partnered with Rare Kids Can, and in pandemic preparedness. So we're really focusing, while we have the resources to really focus on team building and problem solving and complex trial design in a less chaotic environment. So we'll share information as that becomes available. And we'll continue to partner with the Pediatric Child Health Research Meeting. I mean, I'm sure I will be at the Enrich meeting anyways, as will many of you. But we really felt that next year we want to focus specifically on really building relationships. And so we'll continue to offer all of our workshops and respond to the needs of the training community. So if you have training needs, please let us know, and we can hopefully track down an expert or bring in someone internationally. We'll continue to offer letters of support and matching funds for training. So if you are writing a grant, let us know and we can help support you. And our new cohort will start August 1st. So we are going to have an open call August 1st for our next fellows. And with that, those are all of my updates.